gastrointestinal bleeding is a major reason for emergency hospitalization with an annual incidence rate upward of 87 cases per 1 lakh individuals. Most often, the lower gastrointestinal bleeding is a self-limiting condition, with most cases resolving spontaneously. However, major bleeding resulting in blood transfusion surgery and even death can occur in some cases. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I will be talking about the risk factors of lower gastrointestinal bleeding. In a recent systematic review published in JAMA Network Open, it reports the risk scores for lower gastrointestinal bleeding. The Oakland score was the most discriminative for predicting the safe discharge, major bleeding, and need for transfusion, whereas the Straight score was the best at predicting the need for homeostasis. Clinical prediction models or the risk scores can be used to risk the stratify patients with lower gastrointestinal bleeding, although the most discriminative score is still unknown. Observational and interventional studies deriving or validating a lower gastrointestinal bleeding risk score for the prediction of a clinical outcome were included. The studies, including patients younger than 16 years or limited to a specific patient population or a specific cause of bleeding, were excluded. Two investigators independently screened the studies and disagreements were resolved by consensus. A total of 3,300 citations were identified. The Oakland, Strat, the NOBLADS, that is the non-steroidal anti-inflammatory drug use, no diarrhea, no abdominal tenderness, blood pressure, antiplatelet drug use, albumin and disease score and the bleed were all included in the meta-analysis. The Oakland score was the most discriminative one for lower gastrointestinal bleeding risk score for predicting safe discharge, major bleeding and the need for transfusion, whereas the Strat score was considered best for predicting the need for homeostasis. Hence, it was concluded that these scores can be used to predict the outcomes from lower gastrointestinal bleeding and also guide the clinical care professional accordingly. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.